Well, listen to this. Nearly 2 million Americans are addicted to prescription painkillers. And in 2012, doctors wrote 259 million prescriptions for very highly addictive drugs. One state's solution to the growing epidemic: allow addicts to sue the doctors who got them hooked. West Virginia has the highest overdose rate in the country, but many say this could make doctors afraid to prescribe patients the meds they need over fear of getting hauled into court. Here to join us, we've got somebody who knows all about court. We've got Fox News legal analyst Peter Johnson Jr. and somebody who knows all about medicine, Fox News Medical A-Team, Dr. Keith Ablow. Keith, let's start with you. Do you think it's a good idea that people could be able to sue their doctor if they get them hooked on prescription painkillers?
You know what? I don't. Because here's the bottom line. We don't want to do anything like that in a wholesale way to discourage doctors from treating pain. You know, the reason there are so many hundreds of millions of prescriptions written for these addictive pain relievers? Because they work. And there are people out there who are suffering horribly, who without them won't be able to go to work, won't be able to be good parents, won't be able literally to live a decent life. Do we want doctors to say, look, I'm not doing that, because you may come back to me and say, wait, remember, doc, 2 years ago, you wrote me the prescription for Percocet? I'm suing you because I became an addict. Guess what? You know who's responsible when people become addicts? The addict.
Peter, do you think that's right?
Well, you know, I love Dr. Keith Ablow on most things. He's totally wrong on this. This type of lawsuit goes forward every day in the United States. Too much, though, because doctors are killing people all around the United States in pill-popping mills, by failing to refer to pain specialists, by engaging in conduct that exceeds and doesn't meet the standard of care. So we have 47,000 drug overdose deaths every year in 36 states and Washington, D.C. More people die of drug overdoses than car accidents, so it's the highest accidental death rate. And I've got a prescription pad in front of me of a case that I'm involved with right now, in which a patient was prescribed over 6 months about 10,000 oxycodone pills and about 1,000 Xanax pills. So I think Dr. Keith is the most reasonable guy I know. He will agree that that exceeds the standards of care. People need to have the right to seek a remedy when their loved one dies because a doctor doesn't do what a doctor's supposed to be doing in terms of monitoring education.
Peter made a great point. I mean,
I don't want to blame patients for what doctors are doing wrong.
But
that's
Keith,
my point.
You will admit there are doctors who do get people hooked inadvertently, I presume, but nonetheless, it is a problem.
Sure, and there are remedies for that. Boards of registration in medicine, malpractice cases can be brought in extraordinary cases. But to open the floodgates doesn't make sense to me, because guess what? You know what people do who can't get oxycodone or other tablets, OxyContin? Guess what the addicts do? They either buy them on the street or they use heroin. You know why? Because they're addicts.
Unfortunately, physicians, by this epidemic of prescribing this, they're causing the addiction, they're causing the criminality. Let's look at what's going on. Well, let's look at this. You know about the suicide rate at the VA better than anybody. But look at this statistic, Keith. Over 12 years at the VA, they've increased the opiate prescriptions 270%, and their patient load has only increased 40%. What is that about? Is that practice or malpractice?
Because they work.
And more veterans are jumping out windows.
Here's the thing.
Real quick, Keith.
I could prescribe Peter 2,000 oxycodone tablets. Guess what? As soon as he was done using them, he'd go to detox and be back on the job in 10 days. Why? Because he cares about himself. The addict is responsible when the addict becomes hooked.
But when a doctor does that, he should be going to jail and he should be being sued.
Well, you know,
unless you have terrible back pain and migraines, and otherwise you'd be arrested.
Fellas, you both made your points very effectively. All right, we have
Keith.
Very fair and balanced.
We're a good team. I like Peter.
Peter
He's
Johnson,
wrong on this, but
Dr.
I like
Keith Ablow, thank you very much. You both think each other's wrong. All right, there you go.